but doesn't really matter. We'll see how many people we get on tonight. Spontaneous lives and not spontaneous. Was it spontaneous combustion? Just spontaneous lives. This is really annoying. You see the side of my hair there? Has it gone now? No. Anyway, you ain't got time to mess about. We're not here to mess about. We're here to talk, and that's what we're doing right now. Just speaking about bronchiectasis, any other lung condition, how people are feeling, just things like that. If there's any comments, fire away. If not, I'll just ramble like I normally do. I'm not normally lost for words, but I feel like I am today. I've just come live and I've not really thought of what I can talk about, which isn't like me. But yeah, I can just give you a brief what's been going on. So recently finished my IV therapy, which was about 3 weeks ago now. It took me towards the end of the therapy to start feeling the results of the medication working. I had bouts of bad stomach towards the end, which lasted even after the antibiotics, and it's just settling now, which some of the nurses said it's quite normal for you. Some other nurses said, I'm sure you're not that bad. So I don't know, maybe I think some of the medicines were being ran a little bit too fast. You had people filling in. It's called banking. So when you get nurses coming in on a weekend or something, and there's not enough, they'll come from like the intensive care unit ward. They'll come from specialised wards, so they have to run medication fast so they can get onto the next one. So sometimes I was looking down at my phone whilst I was in the house, and I'd look back up and the whole bag of meropenem was done in 10 minutes. And I did feel a bit weird, so I had to tell the nurses, please don't look at me as just a young, strong looking lad and think you can run the medicines too fast, because it was having a negative side effect on me and how I felt. Also my blood pressure was quite low throughout. Now I don't know, not throughout. It was like the last week. So the first week it was just fine, and then going into the last week of the IV therapy, it was quite low. So they said, are you getting enough water in your... I thought I was, but you know what? Because it's warm, when you're getting treatment in summer, we're losing, water through sweat and salts as well. Well, I wasn't drinking enough, so as soon as you up the content of water, my blood pressure came back up, so that was good. I've started my gentamicin now. It's been about a week. I'd say about a week completely off antibiotics. The idea was to jump straight on them. That's always the plan, but it never goes according to plan. You think, give me a break. All my life I'm on these antibiotics. Can't at least have a break. But I cannot have longer than a week or two off them. So I don't play with fire anymore. I don't try and push the boat out and have a couple of weeks off them and see how it goes. So I started the gentamicin back up yesterday. I had one dose because it was too late, and today I've had my first dose, so I can get my second dose in before the night's out. So that's what I'm going to do. I'll probably do that about 10 o'clock, so I've left enough time in between. I need to speak about my breathlessness side. That's been more impacted the older I've got. I always used to say I was more, impacted with chest infections opposed to the breathing side, but it will catch up to you, is what I'm trying to say. Even if you try and keep a level of some kind of fitness when you're well, the breathing side will decline. It always declines with chest conditions, and it seems to be it's declining with me as I'm getting a bit older. I'm only 38 this year, and I reckon by 40 I'm going to be more impacted. Not impacted, I'm hoping anyway, that I don't ever need oxygen. I've spoke to my specialist in the past, and he said, based on CT scans, he doesn't think I need any surgery to remove damaged tissue in the lungs. So this is all promising, but we don't know what the future really holds. We don't know what can progress, what can stay the same. So I am noticing I'm taking that breath in. I'm noticing I have to wheeze more when I breathe in. Normally, I would always say when you're wheezing, it's normally when you breathe out. With infection, you'll notice you've got a wheeze when you breathe out. But my problem is is that I seem to be at a night time, or even when I'm eating food. I don't know if it happens with you, but even when I'm eating food, I have that wheezing and sometimes the danger of choking. So I want you to be very careful when you're eating food with any lung condition. Just chew your food. Try not to speak. Mother's wives' tales, they're very true. Try not to speak whilst you're eating, because sometimes you'll take that big breath in, yeah, and it'll be so unpredictable you won't even know that you're taking that breath in, and you could choke. It happens to me a lot of times, and I have a phobia. I have a phobia of choking because it's happened to me before when I've just been eating food and just watching something on the laptop late at night, and my body just took that breath in. So just be very careful. So that's what I found out within the last few years. I wouldn't say I've major declined, right? I'm not going to say I've major declined, but I will say I've noticed that getting up the stairs is a little bit more harder, if you know what I mean. When I get to the landing, I feel like I'm breathing more. Fitness wise, I couldn't do any kind of, what I did 20 years ago, or 15 years ago, long distance running. That's out the window. What I could possibly do is get on one of them seated bikes, pedal for a bit. So I am trying to keep myself the best I can before I actually decline, is what I'm trying to say. But I've already noticed the decline in me, which is a bit crap, you know. But you know your own body. You know what I mean? You might not look like you're on the decline, as in physically. You might look well, but you know the telltale signs how the body, with age. And a lot of people look at you and say, "You're still young. You're still young," and that might be very, very true. You're still young, but don't patronize a young person with a lung condition to say you're still young. You've still got it. You've still got this, because don't just because an old person has a lung disease. This is what you want you to bear in mind, because you normally associate lung disease with smokers or old people, and you can see that they're actually struggling because they're old. I mean, I think a lot of people patronise young people with lung condition because they look physically well, and I've had it all my life. I've had it all my life. I've had to fight every Tom, Dick, and Harry, because you actually look well. So if you see someone struggling, don't let age be a factor. Listen to them. They're not faking. They're not faking nothing. A chest infection for average Joe. Go and look at a chest infection, how it wipes out an average person out. Look at the common cold. Look at a flu. Look how it wipes a normal person out. So when you're talking about someone who is diagnosed with a lung condition, think how a chest infection will wipe them out more than a well and fit person, because they are not debilitated in any sense of the matter, apart from getting poorly and picking a germ up or having a virus or having an infection. So we've just got to be patient. We've got to be patient. I know it's hard to be patient, and especially if it's a loved one. All right, Donald Duck. Yeah, it's hard to be patient, because you're always giving them this advice, and you're always saying, listen to people who are struggling. Do your nebulizer. Don't just take antibiotics, because people have got a I used to be a fighter, Clive, not anymore. Well, I am a fighter in many sense, but thanks. I'm trying to. You just throw me off, guys. I didn't have no comments, and I've got loads of comments. But yeah, so there's a misconception with lung disease and chest infections. Now, antibiotics serve a great purpose. What they do, they identify the bug, especially if you send a sputum sample. They identify the bug, and then they get the antibiotic in labs, and they try and kill it. They see which one kills it, which one doesn't, which one's resistant, which one isn't. So then they will give the antibiotic, say, to me or whoever who's sent the sample in, and then it's my duty to take that antibiotic for a minimum of 2 weeks, because the first week it kills the infection off. The second week it tries to keep it at bay from coming back. So the difference between a bronchiectasis patient like me or a cystic fibrosis patient compared to, say, a normal person who goes in to the doctor and says he's got a bit of chest pain, the doctor listens to the chest. The first thing the doctor does is prescribe him amoxicillin, because 9 times out of 10 the normal person with a chest infection has got the most common bug, which is called Haemophilus influenza, and that's your standard bug. So they treat it with that, and then hopefully the doctor doesn't want to see the person again because it's killed it off. Well, with us, it's kind of different. we need a 2-week course, because the first week it's killing it off, the second week it's trying to keep it at bay to prolong it coming back. So what can we do to prolong it coming back? Well, there's something called a nebulizer, which is an air pump machine, and it comes with air tubing, a bit like a fish tank tubing. I've got some here, a bit like a fish tank tube. So you put it in, and then you've got 6% or 5% saline, which is salt water. You put it in, you put the mask over your face, and you nebulize for 10 minutes. And then basically, I call the saline, I call the saline nebulizer like a washing machine. So basically, it's trying to move and loosen the mucus up so you can cough it out and clear it. So if you're not doing the washing machine principle on your lungs, or you're not doing the physio to try and remove that shit out your chest, what will happen over time is it will develop, it will grow more in your lungs, and your lungs are like potholes in the ground. Okay, so if your lungs have scar tissue through chest infections, what will happen is this mucus that's not being moved and spat out is now growing in every part of your lungs. It is now flooding every little scar tissue you've got in your lungs, to the point where you're not physically being able to bring it up. Now you're going to have to be counting on the emergency services, being admitted to hospital. So the process really here is, guys, is use common sense. Use common sense. And even though it's a very, very difficult, it's a very difficult condition to live with, it's, with the greatest respect, it's manageable if you have the right people in your corner. And if you have the motivation to say, I'm not going to let this condition define me, when it takes a whole grip of me and finishes me off, then what you have to realise is, you have to keep coming back. Bronchiectasis, I call myself the comeback kid. And I have to have that mentality, because if I don't have that mentality of being a comeback kid, I might as well wave the white flag. I might as well not take my medication. I might as well not send the samples in. I might as well not nebulise. And I might as well not run this channel. So I want you to go away with something from here. Be motivated. Yeah? Try and be motivated in everything that you do, and put that into your treatment as well. Signing out. Take care.